Hi everyone, live viewers, replay viewers. It's Jennifer Hodalgas Element, and the person you see in front of you is Dr. Schiz. Yeah, we'll pull out the screen a little bit so we could actually see your whole face. Hi, Dr. Schiz, how are you?
I'm good, yourself.
I'm good. How's everyone? How's Angela and Cody?
Corey, everybody.
Corey, yeah. Yeah, so
Corey got me on
oh, that's good.
to his phone.
Yeah. Oh, that's good.
I put this on my office Instagram.
Yes, I saw them follow me. I tried to tag them, but I couldn't do it. So, hi Carrie, thanks for watching. So why don't you start? What would you like to tell everyone right now?
All right. So first of all, I greatly appreciate Jennifer inviting me, and I really appreciate all the Instagram videos you're putting out, which is very, very helpful for us as a community as we are all in this alone together with the COVID-19. So I wanted to talk a little bit about my experience first as a pediatrician in Greenwich in a community practice, also as the chairman of the Department of Pediatrics at Greenwich Hospital and the Greenwich Hospital experience, and then a little bit about my own personal opinions about COVID-19, what the future holds, and then I'll open it up to
The questions. Perfect.
So I am in a practice that has 3 other doctors, and as most of the other practices of pediatrics and internal medicine, we've had to change the way we practice medicine. What we have done, and all the other practices as well, is that we are open. We are in the mornings in the office seeing children that need to be seen. So children 2 and younger still need to be seen for their general checkups because they need their vaccinations, and it's critical to continue the vaccinations. So we have parents drive in to the office, they drive to the parking lot, they call. Our staff has masks, our nurses, ourselves, and we have them come in. We space people out. There is nobody in the waiting room. You've been to my office for decades.
Yes.
The waiting room is usually packed.
Yes, it is.
It's very different to be no one in the waiting
room. Okay.
So we do that from about 8:30 to noon, and then the rest of the day we are taking care of sick children and teenagers and young adults. Most of it is telehealth. And our office, as many other offices, are setting up telehealth. The first week it was a little difficult. Now it works very nicely. It is not the same as seeing a patient, but most of the issues can be resolved. And so we do that.
What's telehealth? If you could tell them what telehealth means and everything.
Telehealth is that you go on it's a HIPAA regulated, it's a restricted access telemedicine site, and different practices do different ones. There's MD Doc, there's this, that.
Oh, yeah.
Ours is called Anytime Pediatrics, but it is where it's safe and it's protected and it's HIPAA regulated so that our nothing can be hacked in and so on.
So is that a face-to-face or is that mostly on a phone call?
Just like we're doing now.
Oh, okay. Okay, that's good to know, yeah.
The parent will be talking. This morning I saw telehealth, a 9-month-old with a rash, a 15-year-old, a 22-year-old, and you see the situation. So if someone has a high fever, short of breath, then we have to send them to the emergency room.
Okay.
Thankfully, with pediatrics, we have generally been spared compared to adults. So there are, even in the children's hospitals, at Yale New Haven, at Maria Ferrari,
Yes.
there are only currently now maybe 3 or 4 infants in the hospital, maybe 1 on a ventilator, as opposed to Greenwich Hospital that currently has 120 COVID-19 patients and maybe 15 on ventilators. So this is more of a disease that mainly affects negatively adults, young adults and adults. So, and I think that's been the understanding around the world that children somehow have been spared.
But
it's different than flu, because flu, on a bad flu year, sometimes affects young infants and children worse than adults.
How about children with like severe asthma or immune compromise? Are they also considered high risk?
It seems like they are doing pretty well.
Oh, that's good.
We have a roster of children that have severe asthma or on daily medications. We have children with heart disease. We have children immunocompromised, children with cystic fibrosis, children, unfortunately now undergoing chemotherapy. But in general, as opposed to adults, they have done much better.
Okay.
So that's reassuring, because you expect the children's hospitals, which take care of most of the children with these disorders, to be flooded with patients, and they haven't been. So that's good. And in fact, at Greenwich Hospital, the pediatric floor has been closed for about 3 weeks now, 3-4 weeks. And we are still certainly seeing well babies in the nursery. So from my experience, it has been less worrisome than the internists and the front line.
Yes.
I mean, we got to give a real thank for the sanitary workers, the nursing aides, the scribes, the ER docs, the internists, the hospitalists, the ICU, the surgeons,
the EMS,
ICU, nurses, all of them are putting incredible hours, and they're risking their own health. Not only at Greenwich, but all the other hospitals in the area. The good news is it seems to be coming down. So statistically, the amount of new admissions is down. The amount of patients on ventilators is down. And the amount of discharges are higher than the amount of admissions. So that has just been this weekend. And hopefully the next few weeks, at least in this part of the country, we'll see that. I was pleased to hear last night New York City Hospital was giving ventilators to other hospitals that they didn't need them anymore.
Oh, that's good. Yeah.
So that's great. Now, in terms of therapy, there's a lot of possibilities. What they're doing, and what you got to give credit to researchers, medical centers, medical schools, virologists. They're trying to get facts quickly that might have taken a year, and they're trying to do it in a month. So they're doing clinical trials. I just read today the state of South Dakota is doing a clinical trial with the malaria drug, hydrochloroquine, for the whole state.
Wow.
Trying to answer the question, is it effective? Is it safe? When we should use it? So, for adults, the question is something like malaria drug plus Zithromax good if you have it and you're just sick for a few days? What's best for the more people on ventilators. One thing that's been helpful is people who have had COVID-19 and are now healthy, they can be checked and see what their antibody titers are. If they have a lot of protective antibodies, then they should donate plasma to be given to people on ventilators.
I've heard about that. So what is that
Yeah.
basically? That actually help people that are on ventilators?
If you have an illness, whether it's COVID-19 or flu or chicken pox, you develop antibodies.
Yes.
So you won't get it again. So at first you get IgM antibodies the first 6 weeks, 8 weeks. Then you get IgG. And IgG protects you for a long time. So they're testing these people, and if their antibody titers are high, they're taking the blood, and what they do is the Red Cross does this. They separate the red blood cells and give them back to you, and then they have the plasma.
Ah.
Plasma has these antibodies, and they're giving them to people who are critically ill with the hope what it will do is reduce inflammation. Because what kills people with coronavirus is inflammation in the lung, and then you get something called adult respiratory distress syndrome, and then if you don't get support, whether it's ventilatory support or ECMO, ECMO is for the sickest patients. Patients at Greenwich that need it get transferred to Yale. And what you basically do is you go on a heart-lung machine for a few days, and hopefully your body is resting and inflammation goes down. And the ones who survive, either they're lucky, or their immune system wasn't too bad. So that's what they're trying to do in the intensive care units.
So
There's another medicine.
Sorry, would you recommend then for people who have been cured or okay with this, with the COVID-19, would you highly recommend for them to consider actually donating their plasma to help everyone else?
Yes.
Especially if you're healthy, though.
We have a roster of college students that were in semesters abroad. They were in Barcelona, they were in Milan, and they tested positive. Now they have been well for a week or so, and I've asked them to go online. Mount Sinai, MountSinai.com is the one doing it around here, and you fill out a questionnaire, and if you're a possibility, somehow they get the Red Cross to take your blood.
Oh, wow.
And so hopefully, if any of you know people who tested positive and were well, they should go on that site.
MountSinai.com, basically.
Maybe they can save a life.
Okay, that's good to know.
Sinai's doing it. I'm sure up in Boston and other hospitals doing it in Atlanta and Detroit and Louisiana and so on.
So basically, you don't even need to go to Mount Sinai. You just call your Red Cross and they'll do it for you.
Well, I think you first have to go on to the Mount Sinai site.
Okay.
And then you go on, and it's the COVID-19 therapy or something. And
Okay.
a questionnaire, and then they call you. And if you're, I think if you're O and A blood types are
Yes.
better.
Yes, because O is like a general donor, right? O and A blood type.
O
Yes.
is the universal donor.
Yes, universal
But
donor.
there's
Yes.
There's a algorithm.
Okay.
And if you're a possible candidate, then I think they call you and figure out how to do it.
Okay.
So that's another, and then there's another drug that's an antiviral drug that was used for Ebola virus, against Ebola virus,
Yeah.
and they're testing that also for Corona-19. So hopefully, to get therapies
Yes.
in the next few weeks. The other breakthrough is going to be with
Oh,
So my hope is they're working on this, that they'll be able to take blood from your finger and say, where are you? There's three categories. One is you don't have COVID-19, you've never been exposed to it, you have no protective antibodies. That's one category.
okay.
The second category is you've had COVID-19, but you haven't yet produced protective antibodies. And then the third is you have COVID-19, whether you were symptomatic or not, you have protective antibodies. And I think once we have, and supposedly down the road, they may be able to do it, like even in my office, that we can just take a blood test and run it quickly.
It's like having a strep test, you know it within minutes kind of thing.
Right, or a
Yeah.
flu test.
Yeah.
Right. So how quickly, right now it's only being done for research and for these people to donate plasma. But many medical centers are working on their test, and hopefully soon it will be 300 million tests can be given to America.
Now, what's the purpose of that? So if you need it, you'll get vaccine?
So if you know that you're a fireman, you're a policeman, you're a restaurant owner, and all your workers are immune,
Oh, okay. Yeah.
you can safely open up.
Yeah. Oh, okay.
If you know that you were one of the 50-60% that are asymptomatic and you're protected, you can feel comfortable starting to do things.
Mm.
So maybe colleges are going to start to do things. And colleges are going to say, you know what, we're going to start again in, my son's teaching me how to hold this. Okay. Thank you, Corey. So let's say colleges start end of August.
Yeah.
They may ask the students to do this and say, you're allowed back on campus, but you're not allowed back on campus.
Mm.
You know, and schools and sporting events, you know, that's, I think, what Dr. Fauci was saying about how this is going to be a slow re-entry and a slow back to norm.
I heard that they're going to be having, well, hoping they're going to have a vaccine by fall or something. Now, that would be good, but that's kind of far away.
Yeah, I think realistically, it's probably a year.
Okay.
Because most vaccines take 2 or 3 years.
Yes.
I think they're doing it on the fast track. And
Yes.
I think if we're lucky, I think the fall is very optimistic. I think this time next year would be more realistic.
Mm.
And for any of you out there who are not people who like to vaccinate,
Yes.
you should rethink your philosophy, because everybody should get this vaccine.
This one especially, because it just kills
Right.
so quickly. Yeah.
Right.
Yeah.
'Cause do we want to go through this again? No.
Yeah. That's
And I
true.
think the only silver lining is that as a country, we probably will be well stocked for future pandemics. Like, once this is a low number, the U.S. should make, I don't know, 200,000, put people back to work,
Yeah.
and just store them. And 10 million, 20 million N95 masks and gowns and
Yeah.
gloves. And, you know, because who the heck knows when the next one is coming.
Or whatever the next one would be, at least we would be a lot more prepared than we are now.
Right.
Yeah.
Right. You know, because it's going to be probably a virus that causes respiratory.
Yeah.
That's what MERS was. That's what SARS was. That's what avian flu is. That's what flu is.
Mm.
You know, and, you know, who knows where it comes from or what. I think the Chinese government probably would be smart to stop the wet markets,
Mm.
but that's their call. That, you know, we don't really have a say in that. you're not saying don't eat these delicacies, but do it differently. Because I think that's where these things start up. Who knows?
Yeah. So if you guys have any questions, make sure you type it. Slowly though, but because everyone's gonna start typing at the same time, I won't be able to read it all. So just want to let you know, Dr. Schiz, I'm actually doing Facebook Live at the same time. I'm recording the Instagram Live on Facebook. So I tried to tag Children's Medical. I couldn't do it.
You're very tech savvy.
I'm trying to.
You are.
I think I'm gonna need Corey to show me how to do things. So I have a question though. For people who are asymptomatic, they have the virus but they're not sick. How long are they normally contagious? Are they always going to be contagious or not really?
Well, I think the feeling is now that if you test positive, you should self-quarantine for at least 2 weeks.
Yes.
And if you first had symptoms, let's say you were tested because you had a fever, you had a cough, you have asthma, and you were positive, it's 2 weeks from when you're well.
Oh, from when you're well, not from when you got tested. Right. Oh, okay.
Now, healthcare workers, they've changed that. They've said if you're a healthcare worker, we're going to let you go back to work after 7 days.
Because they need them badly, yeah.
Because there's such a need.
Yes.
But for the general population, I'm telling people just to be on the safe side. And that means in your own room, your own bathroom, meals delivered, not just hanging out with everybody else with a mask.
Yes, yeah.
I can't hear you. Okay. So that's what I've been telling people. Now, again, in a week or two, these recommendations could change.
Everything changes almost on a daily basis.
Right.
Now, what would you say to people who, or just in general, who feel like, wearing a mask is really not necessary? I don't know because I actually was having a conversation with an old colleague of mine, and he mentioned something like, I don't know why people are making such a big deal about wearing masks and social distancing. Everyone's making a big hype about it. So, I suppose.
Well, let's be honest. The whole reason we're starting to see improvement is the social distancing.
Yes.
And the hand washing. Now, wearing the mask protects others from you. That's the whole reason to wear a mask.
Mm.
So let's say I'm an asymptomatic person. I've had it. I'm asymptomatic. I'm starting to wear a mask now when I am going to the grocery store, I always wear it in my office, in my hospital. That's a given. But I'm just saying, I think it's a good idea to wear a mask because if you're in Iceland, they tested everybody in Iceland. Now, Iceland's a small country.
Yeah.
50% of the COVID-19 people were asymptomatic.
Mm.
So if they wear masks, it protects others from them.
Yes.
That's the only reason to use it. It doesn't protect you from others. And it probably makes sense. Look, it's a little bit annoying, but once you start doing it, anything we can do as society to minimize this, let's do it.
Well, yeah, that's true. Because one of the things they were saying actually is that, yes, you wear a mask because you don't know if you have it or not. You protect everyone else. And the thing is, what they don't realize, it's the droplets. What people don't realize is when you talk, there are droplets that comes out even if you don't even notice it. And it's those droplets that basically contaminates like the things in the grocery stores. That's why they always say before you bring stuff in, you make sure you clean it and everything like that. And the virus lives for a while. A lot of different doctors have said how long it stays on a plastic bag and all that. Yeah.
You're right. And the thing is, why not be more cautious than less cautious?
So we can all be done sooner rather than later.
So we can all be done soon. Right, exactly. I think a month from now, mid-May, we're going to be in a much better place, both therapeutically, diagnostically, and society-wise.
Yeah.
I think we're going to get numbers that are less horrendous.
Yes.
And maybe if we're lucky in this country, flu kills about 40,000 patients a year, people a year. No one thinks about flu as a killer. But flu season in the United States kills about 40,000 people each year.
Even with the because they don't get the vaccine? Oh, yeah, that's true.
Because the vaccine's not that protective. But so maybe we'll be lucky and COVID-19 will kill around the same.
But it's got to be manageable, basically.
Yeah.
Or maybe less, yeah.
And then the one concern is it going to reappear in the fall? That's where I think this testing is very important.
Is it going to mutate?
There's going to be some people who had it and they get it again. No one's really sure. No one's really sure.
So for people who are home, because what happens sometimes is it's allergy season. I've had this experience myself. I went out and and then my throat started hurting. Like, oh my God, I must have it. You start doing the checklist, and it sometimes, it's like, no, I don't have a fever. So what would be for someone who just have a sore throat or sniffles and everything like that? How could you differentiate allergies, really bad allergies, or if this is just a start of having a COVID-19?
Right. I mean, it's very difficult. If we were able to test everybody quickly, like in the hospital, moms who are going into labor now, I'll tell you what happens at Greenwich Hospital now. As of last week, every mom who's delivering, if they have an elective C-section, they get tested the day before. When they go into active labor, they get tested, and the test comes back within 2 hours to make sure that they're not the asymptomatic COVID-19. If they are special isolation, special PPE, personal protective equipment is for all the nurses, doctors, and then the mother and baby at Greenwich are in their own room, isolated. So if that quick test, was available to everybody,
and
you could do it in my office, then you could distinguish easily between bad allergy and COVID. But if not, what I've been telling patients is, look, if you know what your allergies are like, and this is about the same, assume it's that. Allergies generally do not cause fever, chills, and they usually don't cause shortness of breath. So any adult with fever, chills, shortness of breath, they got to reach out to their doctor.
Okay.
If they're really bad, they got to go to the hospital.
Now, how about for parents whose kids are just sick but they're afraid to go see a pediatrician or anything like that? That telehealth actually would be a big help. So
yes, that's what we use it for. We've seen a lot of children who have fevers, coughs. Now we can't listen to them, but we can look at them.
Yeah.
And we can distinguish between somebody in respiratory distress and somebody not. And then if we're concerned, then we have to say, hey, you know what? Come to our office. Because we've seen a few patients who are wheezing. They haven't had, they're not too bad. And then thankfully, we have not had to have anyone go to the hospital.
That's good.
But same with adults. I assume all the internal medicine practices are doing telemedicine as well.
Yeah, I think it's something you really have to do it because right now, they try to avoid people coming into, the doctor's office.
Right.
Yeah, because you don't want to infect anyone else just in case you are sick of COVID and all that. So which is understandable. But one thing that, as a mom and everything like that, if you guys see I have to say, I have known Dr. Schiz for, oh my gosh, 22 years now.
Something like that, right.
So his practice, he's with Children's Medical Group in Greenwich. And I have to say, a lot of people are watching right now on Facebook Live, and I'm sure a lot of them, Carrie Dunn, I think her kids are or used to be your patient and everything. But, one thing I really have to say about your practice is that you are used by, well, I can speak, because, with regards to you, because you have been my kid's pediatrician for a very long time. One thing I really love about you and your office is that you guys really truly care about your patient. Your patients are not just a number or anything like that. And pretty much you've known, I mean, you know the patients, you know their name, you know a lot about them. And one of the best thing for me that was a big help when my kids were little is that, that's a beauty of, in the live video, we get all the distraction too, which is fine.
Right.
Is that one of the things, and for all you parents out there that are looking for a really good pediatrician, I speak from my heart. One thing I love about Children's Medical Group is that we could call you. They have someone on call, not a machine. When they always have someone on call, and if you really need a pediatrician, you call them, and a doctor, whoever is on call, is going to call you back within 15, 20 minutes. And believe it or not, I have friends where they, their pediatrician don't have that kind of practice. And for someone, who has young children or first-time moms who's really, who's scared. I was when I came here in 97. I moved here, I had no one. And it was I was just so happy that, we had we have you as a pediatrician, because, we always have someone from your office that calls us. And that to me, that's really exceptional service. That's just, and I really, really appreciate that, and I just had to say that.
Thanks. I appreciate it. And look, as chairman, I know all the other practices in the community, and I have to say they're all also very dedicated, and pretty much all the practices I know are also have on calls and try to get back to you. So, I think as our specialty, we need to be available. So do the OBs.
Yes.
The dermatologist, the internist, who knows?
Not so much. As you get older, it's different. Unless you have a concierge doctor, then that's something else. Okay, do you guys have any questions? I guess they just wanted to listen too. Is there anything else you want to tell everyone, Dr. Schiz?
No, I'll be happy to answer any questions, and if there's another topic that people want to ask, I'll do my best to answer it.
I actually had someone message me because they couldn't come to the right today. The question of whether regular milk, cow's milk, or other kind of milk, how often are they supposed to, give their children milk? I don't know why they ask it, but my kids are a lot older, so.
Generally, I recommend transitioning from either breast milk or formula. If moms are nursing whenever they wean, which most times is by a year, some moms nurse till 2. So once a child becomes a toddler after the first birthday, we transition to milk. I do think cow's milk is fine. I do, knowing my wife.
Yes.
Nutritionist, so I do recommend organic. But I do say it's whole milk, and it's usually no more than 2 cups a day, 10 ounces a day. Some parents don't want to use cow's milk, so almond milk is fine, coconut milk is fine, rice milk is fine, soy milk is fine. Some children have significant allergies.
Yeah, like my baby.
On cow's milk, but it's usually between a year and 13, 14 months that you transition.
Now, when do you? Because I had moms asking, whether yes, cow's milk. Why whole milk? Why less fat, like a 3%? When do you introduce them to fat-free milk?
because until the children are 2 or 3, they need the fats in milk to help build the nervous system. The fats in milk that may not be healthy for us as adults are good for children because it builds the covering of the neurons. And then somewhere between 2.5 and 3, you want to cut down to either 2% or 1%.
Oh, okay.
Whole milk is 3%.
Oh, okay.
Yeah. So that's the reason it's whole.
So that's why they ask about. So there is a reason why they do that. Okay, that makes sense. But for people or kids who cannot have cow's milk, where else can you get? That might be an answer question. What can you use as a substitute? Because
you can use almond milk.
Oh, the fats in almond milk.
Soy milk.
Okay.
All different milks. I mean, you can use goat's milk.
Yeah.
You got to make sure it's pasteurized.
Yes.
You know, because there's some parents like goat's milk.
Yeah.
Just tell them make sure it's pasteurized, not just unpasteurized, because that can cause a lot of bacterial diseases.
Okay. And then, so 2 to 3, they still need to do the normal whole milk. Once they, like after 3, then they can go to a 2% milk and 2 cups a day minimum for a child, basically.
Yeah, that's a good idea. About 10 ounces, 12 ounces a day.
Now for people who worry about their kids not eating, these are the questions I got. Oh, my child doesn't eat. All they want is like hot dogs and stuff. I'm worried about my child's growth. They're not growing enough. What would you recommend? What would you tell people who are like...
Well, first of all, it depends on the age group. Because generally toddlers, a healthy toddler from 1 to 4, a lot of times they're not eating 3 meals a day. Most times if you get one good meal, another's okay, and the last one, they don't usually eat 3 meals a day. They definitely do not get per meal everything healthy.
Yeah.
But what you want to try to do right from the beginning is model healthy foods. So maybe we never introduce hot dogs.
Yeah.
Until they go to their first ball game. And maybe we don't go to McDonald's and Wendy's and Taco Bell. With your own children, they're adults now.
Yeah.
When they started being teenagers, they ate whatever garbage, they would eat with their friends.
Yeah, my kids were not...
The more we can, and you don't have to be, everything has to be organic, but you want to say, the things you want to minimize are processed sugar, which is terrible.
Yeah.
And unhealthy fried fatty foods.
Yeah.
That's what you want to do. And then again, we all have there's the 7-year-old that all they eat are hot dogs,
pizza,
and mac and cheese, and they eat 5 things. Eventually, you can't fight with them too much. You try occasionally to say, this is carrot, this is broccoli, and that's what you can do. All right, Angela said 2 vegetables every day, whether they eat them or not.
Yeah, at least it's an option.
But, there are these stubborn ones, but you try to model, and a lot of children are not great eaters at kindergarten, and by 4th grade, they eat better.
Yeah.
But the thing you probably don't want to do is have a battlefield with meals.
Yes.
Not
Yeah. Yeah. Yeah.
Unless they go to the doctor and they're actually losing weight and not growing. Because, even if with the worst diets, most kids grow pretty well.
That's true. Yeah, because the last thing, I had friends where the child ended up having an eating disorder because it's just like, the parent became so obsessed with, you have to eat this, and it's just like, anyway. So,
that can cause problems when they're adolescents.
Yes. So, any last tips for anyone with regards to COVID or staying healthy and anything else you want to tell them?
I think the thing is, we're all living differently. And let's be honest, most of us are social beings. You know, Jennifer, you usually go to festivals. I see all your
Yes.
this restaurant open and this festival, and so we can't do that anymore.
Yeah.
So we got to keep our sanity, right?
Yes.
So one thing is eating healthy, and the other is exercise. You got to do that. Now, I belong to Equinox, and they send us every day a workout.
Yeah.
I'm not saying I do it every day, but they're good workouts. They're half an hour, they're 40 minutes, they're with weights, without, and it keeps you active.
So actually, speaking of that then, for exercise, for children, teenagers they're all homebound right now. And some of them don't have the luxury of, having a backyard and all that. They're stuck in an apartment. What would you recommend to them they need to do as exercise?
Have a phone, which most of them do.
Yes.
Google free app, teenage workouts. And there's a million free apps.
Okay.
And they can pick the one. They like power yoga, they can do that. They want a calisthenics, they can do that. And they can work out. And that's a great thing. If they have a bicycle and they're just by themselves, can ride, not near people, that's enough.
Yeah.
So that's important. And when we're talking about teenagers and stuff, it's important for them. A lot of stuff comes out from COVID-19 that is scams.
Yes.
And a lot's on social media.
Yes.
So they should be careful about that.
Do you remember what you told Gabby one time? Because when she's at the dorm, so you don't really have a big space. Remember what you told her? I think what you're supposed to do, at least 10 minutes? Do jumping jack. You don't need a lot of space to do jumping jacks. Or just go run from one end to the other end of the room back and forth. So just something to do. Is that just for the cardio? Because Angela last week was talking about you need to increase your lung health. And is that what cardio does?
And yoga does that too. You don't need a lot of space to do yoga.
That's true. That is true.
And if you can walk outside. But you don't need a lot of space to do yoga. And some of these free apps are very good for cardio.
Yes. Yes. So you would say at least, 15 minutes a day? At least.
I would say 15 minutes to a half an hour a day.
Okay. I actually was saying to someone, she was saying, oh, my son, all he does is play video games. I said, why don't you have your son play video games standing up and march in place? I mean, we have to improvise, know.
Well, tell him when he wins the video game, then he has to stop and do 20 jumping jacks and 20 push-ups and 20 sit-ups.
Yeah. Well, and another thing is I forgot who was telling me for everyone who just wants to, for people who are, let's say, for example, semi-handicapped, this is just in general, no longer pediatrician, kids. You know how, a couple of things that someone used to tell me, if you watch TV all the time, during commercial, get up, get yourself water, come back, or just walk back and forth. Or there are certain exercises, everything is in YouTube right now. I'm sure you could just watch YouTube, just at least do your arms or just do your legs. Raise your legs while you're sitting down, anything. And something is better than nothing, basically.
Exactly. And then the other thing is, it is a time of stress.
Yes.
And I know that mental health professionals are available. We, in our office, a lot of the psychologists have reached out to us. I know Yale New Haven has a number to call. And they're doing telemedicine counseling for families, for adults. So reach out. There's numbers, I think Connecticut, if you go on Connecticut Gov, there's a list. And that's helpful for some people to just realize that they're not in it alone.
Yes.
And that's important too, because the mental health of our society is at risk, and it probably will be, because this is like a post-traumatic stress disorder. Down the road,
yeah,
6 months from now, look at 9/11.
Yeah.
How many of the first responders and the people there ended up down the road having problems? Well, we're going to have a country like that,
Yeah.
a world like that. So the therapists are going to be very busy in the next, 3 to 6 months. So if people are struggling, reach out. They're not alone. They can reach out to their doctor, or I'm sure Greenwich Hospital has some kind of setup, and I know therapists in town are able to do some kind of telemedicine counseling.
What would you recommend, or what would you say to parents out there who are not normally used to, because right now they're like, I know someone who has 4 kids, and she's just like, oh my God, I think I'm going to start drinking now. Like, what would you recommend for parents who are now with their children all the time, and like,
And the parents are home working.
Yes.
So it's a great stress. So if they have a backyard, that's a great thing. The kids to run around, and some time for themselves. So hopefully they'll have a routine so they can go to bed. They're probably helping them with distance learning if they're little,
Yeah.
and so it's very hectic.
Yeah.
And so they got to carve out time for themselves to meditate, to exercise. It's not harmful. I'm not saying you should have 3 martinis a night, but it's not harmful to have, what are people doing, like Zoom cocktail, and
Yes.
just take a little break, because it is stressful.
One thing that I have noticed, though, because as you know, I do a lot of social media and stuff, is that when this started, I was so caught up with like everything COVID-19 that like it started to get, and you'll know when you've had enough, because you started feeling stressed yourself by reading stuff. So
Right.
I made a conscious effort to like, no, sometimes ignorance is bliss, but to a certain extent, you need to know what's going on, but not too much that you're obsessed with it.
Right, because now every day we have de Blasio, we have Cuomo, we have Trump, and after a while,
Yeah.
do you need to really listen to all 3 of them for 6 hours a day? And sometimes you don't even want to listen to the news.
I haven't looked at the news
And you
except the
gotta-
weather
right,
report.
You
Yeah.
got to go on, watch TV and series you never thought you'd watch, or something like that. You definitely do have to break a break. Yeah.
How about for kids who, because they're home all the time, they're really all into video games?
Well, look, this is a different period. So if they are doing their social learning and they're accomplishing what they're supposed to do, then you can say, let's say you had a home where you'd only allow half an hour on school nights.
Yeah.
You might allow more than that.
Yeah.
But you got to have to set some limits where first you have to do this, then you can do that. Angela was telling me another great thing, which she recommends, is cooking with your kids.
Yes.
If they're old enough, that's a great thing.
Yes. Yeah, that's true. One of the things I was talking to a mom. She's a client of mine. Her, her I have her place as her home I listed her home, and she was explaining. I think for everyone's mental health, I think it's good for the parents to have their own social happy hour kind of thing via Zoom and everything. But I think it would be also very important for your children to have them have their Zoom meeting, have the parents set it up so the kids can talk to themselves. They may be playing video games, but they're watching, they can have a conversation, which they normally can't which they can't right now. They can't hang out, but they can still hang out virtually. I think if you do that, it kind of like breaks the, I have to do my work, I have to do this. It kind of like have something for them to look forward to. And it's still socializing. It's just that, in the comfort of their own home.
Right. And and especially on weekends, that's something.
That's true.
You know.
That is very true.
Yeah.
Well, anything else you want to say? Because we've taken
No,
so
I
much of your
appreciate it.
time.
I need to run back to my office now and do some more telemedicine, but I really appreciate it, and hopefully everybody stays healthy. That's the most important thing.
Thank you.
And stay home.
Thank you so much, Dr. Schiz, for such an informative, almost an hour. Thank you. Enjoy
Okay,
your week.
Take care.
Take care.
Bye-bye.
Bye. Hi, guys. Thank you so much. Thank you for joining. I really appreciate it. I hope you found that very useful. I'm having the next meeting would be on Thursday. I will have Billy Blanks Jr., who is going to talk to us about Dance It Out and all that. Anyway, thank you again for joining. I hope you had fun. I hope you learned something. Feel free to share. Be safe, stay healthy, take care, and enjoy your day. Thanks for joining. Bye.